To Medici by Lakshmi. So today we will be discussing parental route, which can be coming as a 5 mark question, or you have to write it under the routes of administration. So let's get into the video. Parental route. It's a route of administration other than enteral route. Enteral route, what and all we saw? Oral, sublingual, rectal. Other than that, it's called the parental route. The limitations of oral administration are circumvented. And the parenteral route can be divided into two, injectable and non-injectable. Okay, so under injectable, first we are going to discuss subcutaneous route. So what happened when we are giving a subcutaneous injection? Drug is getting deposited loose in the loose subcutaneous tissue. So okay, now this subcutaneous tissue is richly supplied by the nerves, and it is also less vascular, but through this route only small amount can be injected. Okay, so drug is deposited in the loose subcutaneous tissue. Subcutaneous tissue is richly supplied by the nerves and it is less vascular, only small amount can be injected. One of the two advantages are that it is self injection is possible. You have seen people with the diabetes taking insulin, right, on their own. But proper instruction should be given. Self injection is possible and depository preparations can be inserted through the subcutaneous tissue. One of the disadvantages, it is suitable only for non-irritant drugs. Since it is very highly innervated by the nerves, we can't give irritant drugs. Only non-irritant drugs can be used through this pathway. Then drug absorption is slow. Okay. Second parenteral route is intramuscular route. Intramuscular, it is injected in mostly in the deltoid, triceps, gluteus maximus, etc. And the muscles, when we are injecting, it is there is less supply by the nerves compared to the subcutaneous, but it is more vascular. Therefore, mild irritants can be given through this pathway. Advantage is that it is less painful, and depot depository preparation also can be injected. Disadvantage is that self-injection is impracticable because deep penetration is needed, should be avoided in anticoagulant treated patients because it will produce local hematoma. Okay. Now third is intravenous route. Intravenous route, we have seen it also. Drugs are injected directly into the bloodstream through a vein. We see people injecting the needle here, right? So drugs are injected directly into the blood through a vein, and it is administered as bolus or a slow IV. If it is in the bolus form, it can be single relative large doses given. Example, Rantidine is an example. And if it is slow IV, like example morphine for myocardial infarction, what we give. Advantage you have to remember, it's important for MCQ also. Bioavailability is 100%, and it can be used to administer irritants also, irritant drugs, and it is useful in emergency cases, and even large volumes can be infused. These are the advantages. Now, the last injection type is intradermal injection. It is injected into the layers of the skin. Example, BCG vaccine, and some sensitivity test dose will be given through the intradermal route. Now we are going to the non-injectable part. Non-injectables contain inhalation, nasal. First we will discuss inhalation, nasal, transdermal is there, transmucosal is there. We will first discuss inhalation. That is, volatile liquids and gases are given by inhalation for systemic effects. For systemic effects, we are giving the volatile liquids and gases. Example, general anesthetics. Nasal, the mucous membrane of the nose can readily absorb many drugs. The mucous membrane of the nose can absorb many drugs. Example, growth or GnRH agonist. Now the next route is transdermal route, which can also come as a 5-mark question separately. Okay. Now this transdermal route, the drug is administered in the form of a patch or ointment that delivers the drug into the circulation for systemic effect. So it's almost like a patch or ointment that we will apply, and this drug will get into the circulation slowly, and we can also, time is also there, circulation for systemic effect. Example, scopolamine patch for sialorrhea and motion sickness, nitroglycerin patch or ointment for angina. Okay. Now, what are the advantages of this route? Self-administration is possible, and patient compliance is better. Oh my God, 1 minute. Patient compliance is better. Duration of action is prolonged, systemic side effect is decreased, and first pass metabolism is bypassed. Now, what are the disadvantages? It is a very expensive. Local irritation cause the dermatitis and itching. Patch may fall off unnoticed. Now, few more examples are there. Transdermal patch for GTN, phenatyl, phentyl, and nicotine and estradiol. And for that extra edge, what are the special drug delivery systems? Ocusert, example pilocarpine ocusert, progestrate, liposome, example amphotericin beta, monoclonal antibodies, example delivery of anti-cancer drug elating stains, example paclitaxel, and computerized miniature pumps, example insulin pump. So by that we finished our routes of administration and the subtopic parental route of administration. So parental route as such can come as a 5 mark question. This transdermal route can come as a 5 mark question. Or this route of administration can also be named in another type, formed in another type of question called newer drug delivery systems. And that's it.